Hi, welcome back YouTubers to my channel of an everyday life of an Aspie. If you're new to my channel, I welcome you newbies. My name is AspieAnswersAll, and I'm all about creating mental health and awareness, taking you on a journey with my story of suspicious syndrome, OCD, anxiety and the like, as well as just some self-help tips along the way with different health conditions that is out there that hopefully will create an awareness and understanding, as well as just, like I said many times before, removing the stigma and stereotyping of certain differences of different disabilities that will likely to evolve around certain people's mindset about what they are, the misgivings and misunderstandings about what it's all about. We shouldn't actually, as I should say, judge people on their everyday life of how they cope and how they deal with it in their own way. Everybody does their way of managing their own kinds of, everyday symptoms of their conditions, and it just gets harder each time when it comes down to many people just, doing that judgmentality call that they feel to, judge and that. But enough further ado, guys. Basically, for the ones that has been following me so far, right from the very let go, I welcome you back and thank you for supporting me and actually taking the time to journey with me regardless. And also another food for thought also basically is that at this kind of time I'm actually, also hoping to bring out some more encouragement or little pills of wisdom of certain everyday topics that we go through, be it relationship breakdowns and all that. So that's in the beauty playlist from Ash's playlist, even though it's supposed to be basically another separate, channel. But as someone suggested to me, it might be too hard work, which I'll take that advice up, even though I don't mind trying to work myself hard doing what I have to do anyway. But I know that sometimes many of you mean well when you look out for me when I ask for help or just a little bit of tips and advice along the way of what needs to be done. So therefore, now I just brought up a topic of the disability series right now, which is covered so far the ADHD series, which some are missing. I humbly apologise. They'll be back on track soon. And now this is the ADD series, which basically at the moment it all covered with the introduction, what it is basically, just the testing for adults and kids, basically the signs and symptoms, the effects of ADD, help for adults and the like. And basically right now I'm covering like autism and ADHD, ADD I should say, in adults. So let's begin before I run out. As we know, basically, as I said so many times before, with certain pre-diagnosed conditions, be it your ADD, ADHD, and that, even though we may be misdiagnosed with it, sometimes some of these diagnoses will come into play hand in hand. Here's an example as I'm addressing to you today, which is the autism spectrum disorder. They are related in several ways. They have some of the same symptoms, however, even though that makes it harder for basically, clinical experts on that medical scale trying to sustain, what's going to be labelled as what, or what's going to be called for what of these diagnoses, basically. And sometimes it's hard to differentiate sometimes with them because some of these disorders, as I've shared, are similar in some ways of these signs and symptoms, and that there needs to be maybe more research and understanding by the professionals versus, just us in general, as well as, just maybe the whole of the public, so to speak. Having one of these conditions also may increase the risk of having another, however. Experts recently changed the way they thought about basically how autism and ADHD are related not so long ago in the 4th edition of the Diagnostic and Statistical Manual of Mental Disorders. It stated that a person couldn't have autism and ADHD, but the newest version, as we know, of the DSM-IV pretty much allows for a person to be diagnosed with both. But let me back up the boat a bit right now and talk about how the symptoms of autism and ADHD, even though it's supposed to be ADD, but I humbly apologise because ADD and ADHD is similar in their symptoms, can overlap with one another. Here are 2 classic examples for you just to maybe bear in mind as I'm addressing this to you right now. Okay, the first example is trouble paying attention. As we know, basically, sometimes many of us will have low attention span, okay, especially kids with autism versus, people with ADHD. They may struggle with this for several reasons. One of which is the language difficulties, obviously, as they can't seem to make out like a child. isn't paying attention to the direction that's given to them or some form of instructions that they were supposed to be doing. Hence why I gave you some tips and advice along the way, basically how to go about it, which is later on in the piece. But the truth is that maybe they just don't understand their direction. So pay attention to what you're saying and how you're saying it to the child. Maybe make it in little baby language so they can understand. Or another food for thought for a tip here is basically maybe draw some diagrams. Some people with ADD, ADHD are visual learners versus tactile learners versus, written and the like. Okay, the other classic example here that I've got here is trouble with social interactions. Okay, ADHD can affect social skills. This might include avoiding eye contact and getting to the other people's personal space. Alright, as we know. Sometimes these overlapping symptoms can cause a child to be incorrectly diagnosed with one condition rather than the other. Here's my classic cases I said before in the very beginning with me. I was misdiagnosed. They thought that it was either ADD or some other form of learning disability until it was clinically shown so many times before that I was showing classic signs of basically Asperger's syndrome. If you ever were concerned about a possible misdiagnosis, however, as always, seek medical help or talk to your child's doctor and actually ask for their advice and opinion and what can be done about it. Doctors are usually very used to having these kind of conversations with everyday people and can even help you to get a second opinion if need be. But you've got to be rest assured though, as I said before, one of the classic cases, when it comes down to it, you need to basically be aware that, you can't stop just to one opinion, especially in these kind of conditions, because you need to at least do more research about it, because we need to really know what's going on. In addition to the issue of these overlapping symptoms that I've addressed to you earlier in the piece, it's important to know that having one condition increases the chance of affecting symptoms of the other. What I mean here, many developmental issues are like this. They're likely to occur together. For example, give you another one to give you a base understanding is children with language issues are more likely to have reading disorders. Okay, that's why it's important to consider all aspects of a child's developmental functioning. This will include language, social skills, attention, behavior, mood, academic skills, social skills, play skills, and motor skills. A detailed neuropsychological evaluation and or assessment by a professional healthcare provider will ensure that all areas of the development are addressed, however, to you. And having a complete picture can help you ensure that a child will get the right support. Another way that autism and ADHD are related is that they share this genetic risk. A person with autism has an increased chance of having a close relative with ADHD or another developmental disorder. More research is needed to be understood by these genetic risks, however, but some experts think there are maybe some underlying basis for autism and ADHD. Because autism and ADHD often have overlapping symptoms, some of the intervention for one can be helpful for the other. So like I said, many treatments versus, methodological approach on how to, manage and cope with these symptoms will vary from person to person, so be on one. For a classic example here, children with both conditions usually benefit from sticking to a routine and knowing what to expect. However, there are also big differences in the type of therapy that is recommended for each child. Bear that in mind though. Therefore, what I'm saying here, therapy for autism, such as the like of applied behavior analysis, ABA, which many people don't believe in the world of us being autistic, can be used to help with communication skills. But then again, everyone's entitled for their differences of opinion when it comes to this. It can also help reduce the repetitive behaviors, which is one of the hallmarks of autism, however. But then again, as I said so many times before, you can't cure autism, you can't cure ADHD, you can't cure whatever. There's no magic fix. It's all about managing and coping the best way we can, even though we feel that we have to fit in everyone's one shoe size fits all category. Therapy for ADHD, however, is geared toward improving attention and organisation. This therapy is often paired with ADHD medication, but this medication may not help kids who don't have ADHD. Basically, this ends about the Autism and ADHD part 5 of my ADD, even though I humbly apologise. As I said before, ADHD and ADD sometimes go hand in hand with their similarities and differences, as I addressed earlier on the piece. So in all further ado, basically, guys, give me the like for thumbs up for support. Comment below if I've missed anything that you feel that should be addressed in these or what have you, or even just comment below for the ones that maybe, you know, has these conditions, to give us the heads up how you guys manage and cope. I challenge you maybe for the ones that are watching that, you know, has these conditions. It'd be nice to just spread awareness and actually know how you work, so that, you know, when someone approaches you, they know the right way about dealing with you, sort of thing, so that hopefully maybe, you know, there's no misunderstandings, misgivings and the like. Follow me on Twitter, Facebook, AspieAnswersAll. Private message me on AspieAnswersAll, as well as direct messaging me if you feel the need to on YouTube. Also subscribe to my channel on the daily, weekly vlogs. You know, as I said before, even though there may be many changes, I'll be still around, basically, even though I'm trying to make sure that there are as many videos as possible before I make that big move, because now, just to let you know, basically it'll be next Saturday week. So if you don't see any videos leading up to next Saturday, I humbly apologise, but there should be some coming up. You know, I can't always guarantee it, but I'll do the best I can. You know, it's all about hopefully us engaging and communicating and letting you guys know what's going on, sort of thing, so that we can support each other. And also, don't forget, guys, the ones that always just speaks me to come on your channel, I'll hopefully come on your guys' channel basically as soon as I can, to binge watch and show my support basically to my subscription list who's on there at the moment. I just humbly apologise if you feel that you're left out or missed out or whatever the case may be, but you know guys know what's happening at the moment. So if you don't see me around commenting or liking or whatever the case may be, just to show that I am actually engaging with your content, just bear with me, because it's going to take a while to get back into hopefully my routine and everything else that needs to be done for me. So enough for the go, guys. Thanks for the support, thanks for watching. Until next time, until you see me again, do what you love what you do. Have a great day, and I'll see you all again soon.